it makes kind of sense to start with the pelvis. And one of the first actions for me is to get it oriented, so it makes sense. So here's the the socket, we'll call it for now. And so the femur goes like that, and so it makes sense. That's the only way it would work, just like that. And so when you see that, you go, okay, this is the pubis. Pubis points forward. This is the ischium. It's kind of round like your booty. Okay. And so knowing that much, now we know this is the ischium bone, this is the pubis bone, and this whole region is the ilium. So really the pelvic bone is composed of 3 bones that are fused together when we were very young. Let's start at the top. This is the crest, or iliac crest. We don't see the gluteal line, so I can't touch on that, but we can see this flat area called the ala, where muscles are attaching. There are spines. I mean, they don't look real spine-like, but they're little projections here and here. Now, if you know where the pubis is, then you know these are anterior spines. And you know where the ischium is, then these are posterior. So knowing that much, if these are anterior spines, this one's high, so we'll call it superior. This one's low, we'll call it inferior. So posterior, superior, iliac spine. I'm sorry, anterior, inferior, iliac spine. Got it? So just knowing where the pubis is can tell you a lot. Here we have posterior, superior, posterior, inferior, iliac spine. We have the body of the ilium, which is really just saying that this is the bone or of the ilium. Then we move down to this structure called the ischium, and there's a connection between the ischium and the pubis, and so we're going to call that a ramus, or ramus. So that's the ischial-ramus, and there's a pubic ramus in its inferior position because there's a superior, because these bones are connected via a ramus. Okay, so ischial-ramus, superior inferior ramus of the pubis. Yeah. There's a tubercle here for the ligaments that hold the pelvis together. This is the acetabulum, where the head of the femur articulates, and there's a little notch here, so we get some blood and nerves into that acetabular fossa. So not so bad, huh? Some few words there. So let's look at the head of the femur. Smooth except for the fovea capitis, where we have some blood vessels and some ligaments. They help to keep that from totally dislocating. That would not be a good thing. There is the neck of the femur, and then there's this gluteal tuberosity, and sometimes students are not sure which side is it on. But if you think about it, this goes into my hip like that. This is the right leg, and the gluteus is back here, so this must be the gluteal, hold on. Yeah, that must be the gluteal tuberosity on the kind of the booty side of things. There are 2 big trochanters, they're called. It's a hard cut sound, trochanter, because it's spelled like CH. There's the greater, and there's the lesser. Okay, the greater's on top, it's really big, lesser's smaller. And there's a line that connects the 2 trochanters, and so we call it a line, which is kind of easy. We call it an intertrochanteric line, because inter means between. Intertrochanteric line right there. Okay, we go down the shaft to the 2 condyles. We learned this word before. Condyle is just an articular surface, and there you have it. So this smooth area here is the condyle. Now we already know this is the right leg because of where the head is. So this must be lateral or medial?
Medial.
It's on the lateral side, so this is the medial condyle. If we come up from the condyles a little bit, up means epi, so epicondyle. This would be the lateral epicondyle. This would be the medial. There's a little groove here called the patellar groove, and the patella slides along right there. And sometimes people have knee pain because this patella instead of going up and down, there's a little side-to-side action. And you see him sometimes wearing a little knee brace with a hole on it. It's just kind of a temporary fix to try to keep it in its groove. So it's like that. That's the patella. There's the articular surface of the patella. Apex is kind of the tip. We're done with the femur. It's the sacrum. Sacrum. So here we're at the base of the spinal cord, and we have this promontory, this kind of ridge up here, sacral promontory, and there's a sacral canal. So the spinal cord is going to, or at least part of the spinal cord is going to go down into that canal, and we can access it from the sacral hiatus if we want to inject some numbing medicine. There is the medial sacral crest, it's a crest, and the lateral sacral crest. There's also the, this is called the superior articular facet. It looks like a facet. And so you can imagine the base, the lumbar vertebrae are going to articulate against that nice smooth surface there. We have the sacral foramina, these holes right here, and that's where nerves and blood vessels can exit the sacrum into the tissues around. I think that's it, yeah?